It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of my clients, and the question last week was part 6 of my sister is in intensive care on a balloon pump and ventilated after cardiac surgery. The ICU doctors want to stop treatment against our wishes and let her die. What should we do? You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer the next question from my client Emma, which are excerpts from one-on-one phone and email consulting and advocacy sessions with me. And the question this week is part 7 of My Sister is in Intensive Care on a Balloon Pump and ventilated after cardiac surgery. The intensive care doctors want to stop treatment against our wishes and let her die. What should we do? You can also access previous parts of this one-on-one consulting and advocacy session from part 1 to part 7 below this video if you're clicking on the links. And if you're watching this on YouTube, you click on the link below this video. That'll get you to our website where you have access to all of the other free resources, including the series of these questions. So, Emma writes, Hi Patrick. They have now placed my sister on what they call a lighter sedation overnight. The nurse says her MAP dropped to 40s, so they had to increase the vasopressin to 0.8 and the norepinephrine to 8. They had to just filter on the CRRT and dialysis and not pull. I'm not sure what that means. The nurse said that they tried to do a spontaneous extubation, but my sister kept breathing over the machine and they didn't continue. The nurse said they changed the vent to ASV settings. The nurse says that they are filtering her blood with the CRRT and dialysis, and now at the moment they had to stop pulling fluids because her blood pressure dropped. I don't know what any of that means. Please explain, from Emma. So, here is my response. Hi Emma, thank you for the update and thank you for the pictures. If you could also send a picture of the bedside monitor, that would be great as well. I will give you a call in the next couple of hours anyway. For now, know the following. If the MAP, which stands for mean arterial pressure, dropped, they have done the right thing by increasing the inotropes and vasopressors, such as vasopressin and norepinephrine. The MAP dropping into the 40s could be a result of a combination of things, such as the heart not getting stronger, also because of aggressive fluid removal via CRRT and the dialysis machine, which is what the nurse suggested, and it could also be a result of infection or sepsis. If they tried spontaneous ventilation and your sister didn't like it, there's a good chance she's not quite ready for removal of the breathing tube or extubation yet. I will give you a call shortly. And then I spoke to Emma, and here I'm going to summarize the phone call. Hi Emma, just quickly summarizing our phone call from last night. It's really good news that they changed the sedation from propofol and fentanyl to dexmedetomidine, also known as Precedex. It will help your sister to quote-unquote wake up and then also breathe up. There is no guarantee that the dexmedetomidine or Precedex is going to work, but it looks like she had a good day yesterday and it's definitely worth a try. I have seen dexmedetomidine, also known as Precedex, being ineffective in many patients, but it's too early to see if it's effective or not. We will reassess as we go along. Also, with the inotropes or vasopressors such as norepinephrine and vasopressin going up and down, I'm not too concerned at this stage. Your sister's heart remains weak and she's in chronic kidney failure, hence the need to remove fluids aggressively is obvious, and that will lower her blood pressure. Furthermore, removing fluids is also necessary to offload fluids for a weak heart. The more dry your sister is clinically, the easier it is for the heart to pump blood around the body because of less fluids in the system. Therefore, blood pressure will go down. It's inevitable. Hence, the need to increase the norepinephrine and the vasopressin. The more dry your sister is clinically by removing fluids via the CRRT and dialysis, the more fluids will be kept off her lungs and the easier she should be able to breathe. That's what they're trying to achieve. No big deal at this stage from an intensive care perspective. The dobutamine will be more important to watch for a decrease in rate because dobutamine is improving the pump function of the heart. They will see in the next ultrasound or echocardiogram of the heart if her contractility, also known as the pump function of the heart, has improved or not. They will also have a new estimate of her ejection fraction, also known as EF, after the ultrasound of the heart. If ejection fraction has improved, they will most likely lower the dobutamine, which will be a good sign. Furthermore, what's also important to know is that aggressively removing fluids will keep your sister's lungs dry, which is very important to get her off the ventilator. Not removing fluids aggressively would put strain on the heart to pump blood around the body and would also cause fluids to be pushed into the lungs, making it more difficult for your sister to breathe. Therefore, keeping your sister dry by aggressively removing fluids will help her heart to recover and will support her to come off the ventilator. Again, staying clinically dry will lower your sister's blood pressure, and the norepinephrine and vasopressin take care of that for now, and that'll be okay for a few days. Next, according to the pictures of the ventilator you have sent through, she should be close to be coming off the ventilator if she continues to improve and if she continues to breathe spontaneously and if she keeps waking up. Her volumes area are a little low with 276 mL per breath, but hopefully that'll improve with chest physiotherapy. I think you mentioned that they are starting chest physio. This is going to be important going forward. Please also have a look at some articles and videos. Number one, how to wean a critically ill patient in intensive care off the ventilator and the breathing tube. And the other one is, how long does it take to wake up after an induced coma? I put links to those videos and articles below this video in the written version of this blog. I'm really glad that they mentioned tracheostomy as an option and as a potential next step if she can't be extubated, but it's too early to discuss in detail. We'll talk about it if your sister can't be extubated. Furthermore, talking about a tracheostomy is again a very different discussion to have compared to discussing withdrawing treatment. It shows that they have plans moving forward beyond withdrawing treatment, and it again shows that our strategy works for now and they're trying to do whatever they can to keep your sister alive. Again, please keep in mind that they have taken her off the balloon pump and their predictions of her not surviving off the balloon pump have not come true. Another positive sign. Keep looking for the positive signs. Your sister has gone a really long way. Also, keep engaging the doctors and the nurses, especially if they are more positive. Try and make friends if you can. We will keep looking at their actions and not their words. I really hope that helps for now, Emma. Make sure you get enough sleep, water, and rest and do some good things for you. Keep pacing yourself, and if you need a rest, take a rest. You are the most important person in all of this. If you need to take a day off and you want me to talk to another family member instead, I'm very happy to do this. It's all part of the 7-day unlimited one-on-one consulting and advocacy package which you signed up for. That's it for now. Stay positive. Give yourself a pat on your back for being so strong and proactive, and I'll talk to you tomorrow. Take care. And here is Emma's response. Thank you, Patrick. The nurses say my sister's vital signs are looking better than before. She's still on the drips, dobutamine of 5, vasopressin now 0.04 and norepinephrine 4. The ventilator setting is on spontaneous, and the respiratory therapist person says that my sister is doing good on the ventilator and they are expecting to extubate her soon. My sister is alert and is responding appropriately. As you say, take it 24 hours at a time. We are thankful to God for each day. The nurse said that my sister is making slow and steady progress. I was just waiting to see what directions the doctors are going in concerning her plan of care before I contacted you today to see what direction I needed to take. I'm just praying that they will change their minds and perform her life-saving surgery. Here is my response. Hi, Emma. Overall, from what I can see, your sister is taking small but steady steps forward. If she's now spontaneously breathing, hopefully she can come off the ventilator in the next 24 hours. It would be a huge achievement. It sounds like all they need to be able to achieve is to reduce the pressure support on the ventilator from 12 down to 8. Most patients in intensive care can be extubated on spontaneous ventilation mode, pressure support less than 10 and less than 40% of oxygen. Patients also need to be off sedation, and she is now off it from what you've explained. You can also ask for arterial blood gas results. On the last picture you sent with her monitor, I could see that they are measuring her arterial blood gases. In the last picture you had sent from the ventilator, she was on 40% of oxygen. Hopefully that's either still the same or it has come down even. In terms of the ongoing inotropes and vasopressor support, like the vasopressin, norepinephrine and the dobutamine, for now she still needs them as the heart is still relatively weak, and her challenge with the weak heart continues to keep the fluids off the lungs, which could be very detrimental to getting her extubated. That and the ongoing CRRT on the dialysis machine will keep the lungs clear of fluids. The first inotrope and vasopressor that needs to be weaned off is the vasopressin, then the norepinephrine, and then, last but not least, the dobutamine. Often when patients come off the ventilator, their inotrope vasopressor requirements do go down. Therefore, the next step really is to get your sister extubated. I hope that helps for now, Emma. Still take it one day at a time. The goal for now is to get your sister off the ventilator. It's been really great working with you, and I would love to continue helping you with your sister and with your sister's situation. And we'll talk again tomorrow. Now, if you have watched this so far, if you want to get one-on-one phone and email consulting and advocacy with me, go and click on the top of the website on the consulting options and select from the options that work best for you. So here is Emma's response. Hi Patrick, I just spoke with the nurse. They had to add in another blood pressure medication called epinephrine. They increased the vasopressin, the dobutamine possibly still the same, and they gave her a unit of blood to add volume, the nurse says. They held her dialysis for now because her blood pressure had dropped so low. The nurse said something about patients wax and wane like that all the time, but I'm not sure what it all means. Please advise. So here is my response. Hi Emma, thank you for your email. From the information that you have shared, I would think that they have been aggressively removing fluids with the dialysis machine so that your sister stays dry to keep fluids off the lungs so that she can be extubated. On the other hand, removing fluids aggressively will drop her blood pressure, hence the need to go in with another inotrope or vasopressor like epinephrine. Using another vasopressor or inotrope like epinephrine could be a sign of being too dry because of aggressive fluid removal, or it could mean that her heart is too weak. But it could also mean that they have just simply added in to wean off the vasopressin. Another unit of blood should also help to wean the vasopressin. Your sister's hemoglobin, also known as red blood cells, is probably too low. Here is the order in which they now should remove the inotropes or vasopressors. Number 1 priority should be to get rid of the vasopressin. Number 2 should be the epinephrine. Number 3 should be the norepinephrine, and last but not least, the dobutamine. Sometimes the order can be slightly reversed, but definitely the vasopressin and the epinephrine first, and then it comes down to the norepinephrine and the dobutamine. Also, find out if they think they started the epinephrine because your sister is too dry because of aggressive fluid removal via the dialysis machine, if they think the heart is too weak, or if they want to replace the vasopressin with epinephrine. It would also be good if you can send another picture of the ventilator and the monitor. It would also be good if you could get some results of the arterial blood gases and also some results of the hemoglobin, white cell count and troponin. I hope this is not too confusing. I'm very happy to explain over the phone. I just left a message on your voicemail. Also, are they still trying to take her off the ventilator today? Because that would be really great. Now, look out for part 7 of the one-on-one consulting session in the next few days with Emma, and I'll talk to you then. But here's a really important question for you to consider. How can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, control, power, and influence, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care. And it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I will see you again next week in another update. You can also send me an email to support@intensivecarehotline.com with your questions, or you can call me. Find international phone numbers on the top of the website. Also, have a look at our ebook section. You can also get one-on-one consulting and advocacy with me via Skype, over the phone, or via email by clicking on the products tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.